Welcome everybody to the April meeting of the North Carolina Medicare for All Coalition. We're so happy to have everybody here. And thank you so much for joining us on a Wednesday. We're really excited to have a guest with us, Rose Roach from the Movement for Single Payer, okay. What is it called? I have to...
The Labor Campaign for Single Payer.
Yes. Okay. Thank you. I don't know, I got all tongue-tied there for a second. And it's a labor moment, like I wrote in the email. Will and Jonathan just wrote this great piece for Jacobin. It's just, there's so much that we can be doing. And like Jonathan and Will wrote, you'll see what we have been doing isn't been working. We're still way too far away from achieving our goal, from building that groundswell that we need that can potentially chip away at the influence of money and power, and these people that are doing everything in their power to keep us from achieving a single payer system and keeping us from achieving a lot of things that we desperately need to just live good, decent lives and have the things that we need to not just survive, but actually live a good life. And in the richest country in the world, that should be available to all of us. And healthcare in particular, because as we know, without our health, there's not much else going on there. And no one should go broke in the richest country in the world because they got sick or have an accident. And that is still happening way too much. So thank you all for being here. Again, this started because a couple of us through Healthcare Justice are doing a strategic stakeholder analysis of different groups and to try and figure out where we should be putting our energies in terms of recruiting people into our movement. And unions came up, understandably so, because it's a union moment. And I was like, it's a great thing it's doing this. Why don't we invite them to come to the next meeting? So that is how we happened. Thank you, Doug, for doing the groundwork to invite Rose. And I will stop talking now and I will turn it over to Rose. Thank you so much for being with us, Rose. We really appreciate it.
Absolutely. Thank you all for having me. Before I pull up my slides, I just want to give you a little bit of background. I am now retired from the labor movement. I spent 34 years in the labor movement, both here in Minnesota and in California, representing public school workers. So not certificated, meaning teaching staff, but for the staff who are driving buses and feeding our children and serving as paraeducators and special needs and custodial and environmental services. And then I spent the last 9 years, right before I retired, representing the nurses here at the Minnesota Nurses Association. We had 22 to 23,000 nurses that we represented in Minnesota, North Dakota, Iowa, and Wisconsin. So the largest nurses union up here in the Midwest. I am not myself a nurse. I am not a practitioner. I am just an activist who cares deeply and passionately about this issue and have spent my career in the labor movement watching labor struggle with this, trying to define it as a benefit when it actually is a necessity and should not be within the hands of our bosses to control our access to healthcare. So with that, I started to get involved in policy work and figuring out just what is driving costs and things of that nature. And that brings me to where I am now a volunteer. Any of you who might be retired know what that means in reality. I'm putting in as many hours as I was when I was working full time, both as the chair of Healthcare for All Minnesota and as the national coordinator for the Labor Campaign for Single Payer. I was one of the founding members of that organization inside the House of Labor. So my presentation will tell you a little bit about the Labor Campaign, what we're doing, how we're doing it, why we're doing it, a little history on labor and national health, a national health program, and then offer some ideas on how we at the Labor Campaign can help you get more unions involved in the North Carolina coalition. So I am going to hope that this works out and I can share my screen properly with you all. Are you seeing the screen without the notes? You seeing the notes again? Oh my gosh. I
Yes.
thought I picked the right one. I don't know. I'm telling you, we tried this before and it was very frustrating. Let me try this one and see if this works. Does that work? Okay, yay. Success on the on the simplest things, technology. So again, good evening to all of you health justice activists. My name is Rose Roach. I'm the national coordinator for the labor campaign and chair of Healthcare for All Minnesota. Thanks for inviting me here tonight to talk with you a little bit about the work of the labor campaign for single payer and how together I think that we can work to win real healthcare justice for all. I want to start by grounding us a bit in the current state of our healthcare system, or I would say more appropriately, our healthcare marketplace, because that's what it feels like. When you look at these headlines, and they're all pretty recent within the last year, where is the emphasis on patient care in any of this? It seems to me that if we learned nothing from the COVID-19 pandemic, we certainly learned that health is indeed a public good and not a consumable good. And the insulting question of who deserves health care was definitively answered. We all do, because we're human, and it's just that simple. During the pandemic, a Minnesota nurse wrote something, a blog, and I think it's very powerful, and I think it grounds us in our work together. So I just want to grab a piece of that and read that to you. She said, "If I die, I don't want to be remembered as a hero. I want my death to make you angry too. I want you to politicize my death, use my name to shame those who have profited or failed to act, leaving us to clean up the mess. Don't say heaven has gained an angel. Tell them negligence and greed has murdered a person for choosing a career dedicated to compassion and service." I just think that is such powerful framing for why we are in this movement together. You may all have heard of Dr. Elizabeth Rosenthal. She wrote a book called American Sickness: How Healthcare Became Big Business and How We Can Take It Back. She sums this up by saying the transformation of American medicine in a little over a quarter century from a caring endeavor to the most profitable industry in the United States has made the medical industrial complex, has made money the metric of good medicine. This healthcare marketplace is profit-driven and dysfunctional. Healthcare is a basic human need and a public good for all people, not a consumable good or a business meant for the purpose of profit. And yet, here we are. The way we deliver healthcare in America is broken and getting worse. We all know what the solutions are. It's just that our solutions so far to date have actually made it more difficult to get care because we're using business strategies that maximize profit and not healthcare strategies that maximize health. Both the labor campaign for single payer as well as Healthcare for All Minnesota understand this, which is why we are working really hard, particularly in the labor campaign, to bring more unions into the movement for healthcare justice. You can see all of this nonsense with limited networks and deductibles and copays and pre-authorizations. None of that has anything to do with actual healthcare. So how is the labor campaign really thinking about this? Well, first, a little bit of information about who we are. The labor campaign for single payer is a single issue organization within the organized labor movement. Our affiliates include a number of influential national unions and state federations. Our primary mission is to increase and coordinate grassroots labor support for a single payer Medicare for all healthcare system in America, because we believe that healthcare is a fundamental human right and that the labor movement must help lead in the fight for healthcare justice. The labor campaign is proud of our accomplishments to date, including the passage and maintaining of a strong national AFL-CIO resolution that supports Medicare for all. We are bringing more and more unions into this campaign. We're engaging in a nationwide network of organizations that are working on Medicare for all, and we're just continuing to exist and to stay in this fight, which is worthwhile mentioning as well. With that as a solid foundation, we are now focusing on confronting the status quo, fighting against the privatization of Medicare via Medicare Advantage, expanding and organizing more union support, engaging young workers and activists, and ensuring meaningful debate happens with all of the stakeholders who we welcome to the table, even including those who may not yet agree with Medicare for all, as we attempt to open up space for dialogue and find common ground for our work together. And we are very excited about our future. The labor campaign is structured around the theory of distributive leadership. That increases the buy-in and it expands our reach. Our working group structure allows for maximum involvement of interested union members to help us with the work of growing the organization and the labor's involvement in the Medicare for All national campaign. So the three major working groups we have running for this year is an education working group. We are focusing on working on rank and file member education programs around why labor should not be supporting the privatization of Medicare through Medicare Advantage. We also have a great program called Runaway Inequality and the Crisis in U.S. Healthcare. This is looking at the healthcare crisis from a worker perspective, specifically how it impacts us economically. We have an organizing working group that is doing a labor union survey and doing outreach to various labor unions to bring them into our organization, as well as recruiting new affiliates for the labor campaign and for the movement overall nationally. We have a coalition building working group that is reaching out and building relationship across the entire healthcare justice movement, because we know labor must be part of that movement overall. So before we talk about the future, I want to take a moment to review labor's long history with healthcare reform. A progressive era reform group called the American Association for Labor Legislation, all the way back in 1915, lobbied for protective labor legislation and published critiques concerning pending bills. The first campaign for compulsory health insurance in the United States was started by this organization. The group began studying compulsory health insurance in 1912, and they produced the model bill in 1915. They forged alliances with other organizations and lobbied state legislatures as opposed to the federal government in a campaign that seemed at first destined to prevail. For a time, even the officers of the American Medical Association joined the campaign. But then World War I intervened, commercial insurance companies mounted a powerful opposition, the AMA changed its mind and its position, and the entire episode ended in 1920 when the New York State Assembly killed the bill. The Murray-Wagner-Digno bill was the vehicle that was used in the 1940s to try and achieve a national health insurance program. It was backed by the CIO enthusiastically, but less so by the AFL, which had a philosophical problem with national health care. The AFL had a tradition of the union being the social insurance provider for members, starting with burial benefits back even as early as the 19th century. But by the 1940s, even the AFL was backing a national solution. And for those of you who are physicians here, this happens to be a postcard that the AMA put out to show that the last thing we would ever want is the government between the patient and doctor, relationship. And so this became something that became a bit of propaganda back in the 1940s. Although many unions and the AFL-CIO continued to support a universal national healthcare solution, that approach was politically impossible in Congress after the 1940s defeat. This is the peak of labor's political strength in America. Union membership remains close to 30% of the workforce at this time, and labor's legislative clout, combined with the moral authority of the civil rights movement, pushes Congress to enact universal health care for seniors and the poor in the 1960s. It's not quite strong enough, however, to bring home national health care for all. The labor movement is divided, with some unions still believing that collective bargaining-based health care is a union recruitment tool. Historical amnesia starts to set in, and the substitute means to an end has now become an end itself. Between collective bargaining for the unionized workforce and political advocacy for those outside of unions, the labor movement delivers health care for working families. The AFL-CIO's official position remains in favor of a government-guaranteed universal health care system, but the power of the private insurance industry constrains labor's realm of influence. And almost imperceptibly, as union density shrinks, so does employer-based health care. So we're the only, industrialized nation in the world, as I'm sure you all know, that actually ties our access to healthcare to employment. This is different in America, and it works for a while. But then as the unions start to lose members to offshoring and employers, decisions to relocate manufacturing in countries with cheaper labor and toothless or non-existent labor laws in the 1980s, the ability of unions to to deliver at the bargaining table begins to erode. The medical industrial complex moves to those business strategies I talked about earlier, creating an environment for profiting off of human suffering. The term healthcare crisis begins to make its way into our public discussion. For years, the industry has come up with some kind of scheme that they are always trying to sell us. Remember in the history that I showed in the 80s, we had the PPOs, in the 90s, we had the HMOs, in the 2000s, we've got the ACOs. I call them all EIEIOs. They're all managed care ideology. It is the belief that healthcare costs are high because of how we pay for it, and that the way we pay for it leads to overuse. That's absurd. It is completely without any concrete evidence to support that claim. It is insulting to our healthcare providers, and yet for the last 50 years, this has been the foundation on which all attempts at healthcare reform has been built. The problem is this stuff hasn't worked. It isn't working, and it isn't going to work. Managed care creates things like networks and deductibles and prior authorizations and artificial intelligence and claims denials. They have all failed to do what they've promised to do and continue to promise to do, which is control costs, improve quality, and decrease health disparities. We have to stop this insanity and get serious about what's actually driving costs. It's prices, and start building the infrastructure needed for a healthcare system that is grounded in patient care and the patient-provider relationship. Oops, sorry about that. Although unions in the private sector now represent just 8% of the workforce, where they exist, they do absolutely help to shield working families from the efforts of corporations to dump healthcare costs onto the backs of individual workers. But we have to be honest about this reality. We're still paying for that benefit at the expense of wages, and this is economically unsustainable. The orange line is the increase in family premiums. The darker blue line in the middle there is workers' earnings, and the light blue line towards the bottom is overall inflation. That crocodile or alligator mouth is not sustainable for our economy. It is not sustainable for us as workers and families. And even those with employer-provided insurance need to realize that, according to the Department of Labor, 200 million claims per year are denied, even with our so-called good benefits through our employer-based system. The reality is the insurance companies are making money by denying people health care. That's immoral. For labor, even with the good work that we've done around healthcare benefits, these business strategies that are imposed on us by the insurance industry still exist. We still have to figure out, it's an excellent plan, but guess what? It doesn't cover everything. We usually have to buy separate insurance for dental, eyes, and hearing. Aren't those things all connected, right? To our bodies, to our health? More and more employers are moving away from dependent care and just to covering the employee, which becomes very cost prohibitive for families. Some employers are beginning to incentivize workers to do what we call opt out. Just tell you what, we'll give you a lump sum of money, you go buy your own health insurance benefits. They get out of it altogether, and you can imagine what that does to individuals buying on the individual market. We still have to fight about who's going to pick up the cost, whether it's going to be in the premiums or the out-of-pocket through copays and deductibles. We still get dictated to that this is the group of doctors or hospitals that you're able to get your health care from. And of course, we have to use massive power and bargaining chips at the table in order to try and maintain this as a true benefit, and it is causing wage stagnation, which again is not good for us and not good for the economy overall. And it ends up with a result that takes our access out of our hands, puts it into the hands of our bosses, and they use it as a weapon to divide and conquer us. Whether it's retirees versus active, senior employees versus less senior, they are constantly pitting us against each other. That causes solidarity to wane, and in the end, we all lose. So we know that healthcare is at the heart of almost every battle unions face today. So many contract disputes and campaigns are connected to health insurance. Who's going to pay what portion of the premium? How much are the copays and deductibles going to be? Negotiations with the bosses are the same for all of us. We are the only country, as I said earlier, that links healthcare to employment. You lose your job, you lose your healthcare. And the bosses also use this to bludgeon us if we exercise our right to go on strike. Because once you're off the payroll, they are able to also take you off of the access to your health insurance plan. It's time for labor to call the question. Is healthcare really something to be negotiated? Is it a benefit or is it a necessity? We can't win this at the bargaining table anymore. Our access to healthcare has become this weapon in this class warfare that all of us are engaged in. No social justice movement has ever advanced in this country without support from the labor movement. Our job is to make healthcare for all politically possible. So the advantages for workers under a Medicare for All system are significant. Eliminating the need to bargain over our access to health care so we can increase our bargaining clout to stop the decades of wage stagnation, pump up and restore defined benefit pensions so workers can retire with dignity and economic security. And we have many, many working conditions that we need to improve in this day and age. Union versus non-union workforces become much more competitive with the cost of healthcare being equal and providing comprehensive coverage for us all. As you can see by the union logos on this screen, a majority of workers in the largest unions across the country do in fact support moving to a Medicare for All system. Organized labor deserves kudos for the work they've done over many decades to secure better health benefits for workers covered by a union contract, but we are still held hostage by this industry that has the audacity to think that they know more about our treatment needs than our providers. From a labor perspective, we know that our employer-based healthcare system is a convoluted mess, and that is why the Labor Campaign for Single Payer is working hard to bring more labor unions into the healthcare justice movement, because trying to bargain healthcare benefits is a failed strategy. We're strategizing transitional moves that can bring us closer to Medicare for All. And this gets to what Rebecca was saying earlier. We may not have the conditions to pass Medicare for All in the next few years. That doesn't mean we can't be working to set up the structure that we need to put it into play down the road. So although we're not quite where we need to be, we do think that a strategy that begins implementing important tenets of that system in a way that creates those conditions that we're going to need to make Medicare for All possible is our best chance at winning. Listen, read the Medicare for All bill in Congress. It has a whole section on transitioning. If they passed it today, we wouldn't have Medicare for All cards tomorrow. We would have to wait between 2 to 5 years to actually be in the new system. What are we waiting for? Why don't we start taking the pieces of the transition and let's enact them now? President Biden doesn't support Medicare for All, but he is willing to lower the Medicare eligibility age from 65 to 60. He is willing to take on pharma and start negotiating drug prices. He is willing to talk about expanding benefits and potentially taking on Medicare Advantage to better traditional Medicare. Let's use those moments to be wins for patients and providers and wins for our movement. They help build the infrastructure we're going to need for Medicare for All when it's ready to put all of us into that system. And even on a state basis, we hardly have any public health programs left in this country. Almost all of them have been contracted out to the private sector. We need to deprivatize Medicaid in all of our states and begin to go to direct contracting between the state and the providers, saving bundles of cash. We could expand then those public health programs at the state level. We could do things like creating a single payer pharmaceutical pool at the state level. There's all kinds of creative stuff we can do. Senator Sanders is even thinking about proposing primary care for all as taking a segment of healthcare and making sure we all have access to it, regardless of who we are, where we live, what our race is, what our immigration status is, because again, if you're human, you ought to qualify. So it all comes down to this. In other industrialized nations in the world who provide healthcare for all their citizens in some way, the unions in those countries have figured out that they can't keep their own healthcare benefits without everyone having healthcare. Movements ebb and flow, but the fundamental forces driving the healthcare crisis in the United States remain. We have made some progress injecting this issue back into the mainstream, with a majority of Americans now supporting a Medicare for all style solution, but our primary mission still remains unfulfilled. With very few exceptions, labor has not moved beyond the level of resolutionary politics and into revolutionary politics. We have to take this issue up as an existential fight, prioritize it politically, and resource it. This is so very important, because when labor finally does that, we will win true healthcare justice for all. The labor movement has always been at the forefront of social justice change. Labor is uniquely positioned to lead the way for Medicare for all, and it is our moral imperative to do so. It is truly the ultimate act of solidarity. So I just want to tell you that if you happen to be in a union and you're here tonight, or if you have family members, friends, or know folks that are involved in labor unions, here's a couple of things you can do. Help us help you. If you have labor contacts, let us know who they are. Get in touch with me. Let's maybe schedule this presentation, maybe for their local or for a Central Labor Council executive board. We love to go to conventions or conferences. Many times unions have education days for their members, and they're always looking for presenters. So we've got all kinds of things ready to go to connect you and those labor unions with your fight in North Carolina for Medicare for all. Be sure that you have unions at the table with you. If you're doing a state campaign, or if your state campaign is focused on the national level, it's just important to make sure that labor voices are heard one way or another. They have to be in the room so that all stakeholders get a chance to voice their thoughts. And then look for opportunities where we can really engage with those North Carolina unions, particularly around this egregious privatization that's happening inside of Medicare. We have been successful in passing in Washington state and here in the state of Minnesota a resolution around saying we have to level the playing field between Medicare Advantage plans and traditional Medicare, to make traditional Medicare something that's actually financially an option for retirees, but also for labor unions who are negotiating many times those benefits at the table. We shouldn't be promoting the privatization of Medicare, but we also have to make it financially feasible to move people into traditional Medicare. So we've got all kinds of ideas to help open up space for these conversations. I'm going to get these slides to Doug so he can get them out to all of you, and you can see my notes as well as the slide itself, and you can see all kinds of possible resources that we have on our website, and others that we work with at the Debs Jones Douglas Institute and with the United Electrical Workers, who've got some really good stuff going around how to write a proposal for the bargaining table centered on Medicare for all. So I want to end by quoting Arundhati Roy, an Indian author and activist, because I think she beautifully sums up what we're all about. She says, the system will collapse if we refuse to buy what they are selling, their ideas, their version of history, their wars, their weapons, their notion of inevitability. Remember this, we be many and they be few. They need us more than we need them. Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing, and I can too hear her breathing, and she's reminding us of our common humanity. Let's stand together and fight for each other and the profiting off human suffering, and demand that our elected officials do the same. Si se puede.
Oh, thank you.
Wow. Yay! Let's give Rose a big hand. Love your energy.
Thank you. Oh, good.
That was fantastic.
Well, I hope it helps and raises some, ideas and some energy to see how we can help. And I'm happy to take any questions as well if you want me to hang out for a few minutes.
Oh, yes, please. That would be absolutely wonderful. I am going to go back into gallery view so I can actually see, what did I do? So I can sort of see people. Let me see if I can actually do that. Where is my gallery view? Gallery. Okay. Does anyone have, oh, Will, Stack, and then Howard.
Yeah, I was just going to
Okay.
mentioned, uh, yeah, thanks. That was really inspiring and informative. Um, I was at the UAW rally, the Daimler truck rally yesterday in Statesville, and where Sean Fain, national
Mm,
president of the UAW,
yep.
spoke. And it just seems now we've already kind of started a little bit, some of us in Healthcare for All, to kind of reach out and talk about this some, but I think it would be so important to have healthcare workers, nurses, and physicians, clinicians in white coats, if this strike comes through, to be there on the line with these
Mm,
folks. It just seems so reciprocal. I don't know if you past times in history, if there's anything you would pull from, but I mean, I just think all these powerful, at least in North Carolina, we've had to rely a lot on faith communities, in our social justice struggles, but even our civil rights seem to, it had a huge labor component, at least the modern day civil rights.
absolutely. Hmm.
But I don't know if there's anything you can draw from that or suggestions, but how we can try to mobilize people to be a part of this. Seems like a real opportunity to make the connection stronger, and as well as the chance that the UAW may take on Medicare for All directly.
Yeah, so it's interesting because one of the sort of behind the scenes projects that we are actually going to be working on here this spring is creating a briefing paper that we can present to Sean Fain. I reached out in May of 2023, right after I retired. I actually reached out because he had just won his position, so a new administration was in place at the UAW, and I reached out to their political director. Her name is Dawn Lee. Had a great conversation with her because I wanted the UAW to endorse the Medicare for All bill that was going to once again be introduced in Congress by Representative Jayapal and Senator Sanders, right? For the first time, it was being introduced bicamerally at the same day, at the same time. And the UAW has in the past endorsed it, but they had taken kind of a break, and there had been a couple of sessions where they had not endorsed and signed on to the bill. And so after talking with Dawn for a while and connecting with her, she took it to Sean and they signed on to they endorsed the Medicare for All legislation this year. So that felt like a really good first step. And of course, then they went into their big three contract negotiations. So I said, I'm going to back off here until you all get that taken care of, because that's where your energy needs to go. But since that has been settled and Sean has come out and talked about how he really wants to think about something broader than what we do at the bargaining table, or about issues that should be broader than the bargaining table, and healthcare being one of them. We're thinking about how to reconnect with Dawn and see if we could potentially get an audience with Sean to lay out kind of a game plan and how we could help if he brings together labor throughout this country to think about some of these bigger issues more globally that we should be working on together. I think, I was with the Minnesota Nurses Association. We're an affiliate of National Nurses United. Didn't NNU organize some nurses in North Carolina here in the last few years, right? Yeah.
Yeah, I was a
So
part of that.
okay,
I was an
okay.
organizer with them on the
You should
mission
be able to
because
get them on a strike line if you're, or, picket lines or whatever, because they're pretty big at doing, street theater
right.
and concerted action, pretty
Yeah,
militant.
I talked with some nurses yesterday
Right.
that came down from mission, which was really wonderful to see. Um,
Absolutely.
but yeah, just a coordinated thing like this to me seems like, and the more publicity we could kind of get around that, but definitely folks in scrubs and white coats. Um, I don't know, and it also seems like it'd be great. You all probably have a lot of things you could draw from, the past experiences where we've kind of brought these, if we look at the civil rights, the anti-war movement,
Mhm.
and things like
Yeah.
that. Anyway, I'm taking up somebody else's time probably, but
No, that's okay.
it's
All of
exciting
that.
that you've already made those connections. That's just
Yeah.
already met and are planning on this. So Super.
And I just want to add too that here in Minnesota, 600 physicians just organized with an SEIU Doctors Council, and that is the largest bargaining unit, I think, of physicians in the entire nation. And pretty excited because M&A represents all the nurses in that particular hospital system here. It's the second largest one in the state of Minnesota. So we're already in touch with that leadership so that once they get their first contract in place, because of course, the reason that they unionized was because they're fighting corporate healthcare, right? They're being told how to practice medicine by these corporations that do not have the patient's, in best interest at heart, and they're frustrated by that. And so they found the collective body through the union as being the way to actually take that on. And doctors and nurses together, this is powerful. This is how we can take on corporate healthcare in this country. So we're hoping to get them more active in the broader movement once they get their first contract. Exciting stuff. Yes,
Very.
I think Steve,
How-
I don't know, you have
Howard
Zach,
wa-
you both got.
Howard was next, and then
Okay.
Steve, and then Zach.
Gotcha, thank you.
So thanks so much, Rose. It's
Sure.
great to hear your enthusiasm. I'll say that some of the people who I respect in healthcare and health economics and health policy say that, this is the right thing. Universal single payer is the right thing, but it's going to be impossible to accomplish given the embedded culture and the interests of those who are profiting off the current system, which is kind of discouraging. They sort of say to me, well, Howard, don't spend your time on that. It's hopeless. But it's nice to hear that you don't think it's hopeless. I don't think it's hopeless either. One of the things we've been trying to do with our group, with Healthcare for All NC, is educate the public, because it seems important for pressure to be applied to legislators. In North Carolina, only 2 of our 12 representatives to the U.S. Congress have endorsed the Medicare for All bill, which is striking to me. And I wonder if you have a perspective on what is offered, what arguments that are not totally crazy are offered in opposition to Medicare for All, things we need to be prepared to address with the legislators who aren't on our side.
Yeah, I think, some of it is the typical stuff that it's just, it's socialized medicine, or that it is too costly, right? How it's just going to cost too much. They're not thinking about it in terms of what is it costing us now? And nobody is saying it isn't still going to cost some money. It is about a reallocation of how we use our healthcare dollars. We got more than enough money in this system. We're just not allocating it to actual healthcare. And it's hard because I'm telling you, they've been drinking the Kool-Aid for 50 years, that the way we fix this is to keep tweaking the system, through all of these managed care ideas. Any of you who are, practitioners, this stuff, this value-based payment junk that they've got, all of the coding that is happening, everything is related to billing, and none of it is related to actual health outcomes for patients. One of our Democratic representatives here in Minnesota, Representative Angie Craig, she is absolutely convinced that the cost is high because we overuse healthcare, and we overuse healthcare because greedy doctors get paid on a fee-for-service basis, and they therefore overprescribe care. That is nuts. And I have said to her face, please produce the evidence of that. Now, you have little teeny tiny pockets inside of the system where there are little places where maybe we're over, prescribing something here or there. It's minimal. It is not the main reason why we have high healthcare costs in this country, not in any way, shape, or form. We have evidence supporting what we're saying drive costs, and it's prices. That's why we have to go to a global budgeting system, and we have to figure out what the prices should be to make sure we still protect the workers, meaning the doctors and the nurses and everybody involved in the system, that they get paid for the services they provide. But at the same time, we all know that, I'm going to back up 1 second. I worked with a guy from DSA who was getting his master's degree in public health. He got access to something here in Minnesota called an all payers claim database. It's very private. Not many people can see it. Even the legislators can't see it. And it basically is all of the hospital systems putting data in to say, here's how much it costs for these different types of procedures at our facility, right? And he asked a group of third year, I think third year medical students, he said, how much do you think a cesarean section costs? Well, one raised their hand and said, 10 grand. Another one said, nah, I think it's closer to 20. Someone else said, oh, I bet it's double that. I think it's 40. And you know what he said? He goes, you're all right. Because all those prices, it costs that just depending. Are you northern Minnesota on the Canadian border? Or are you in the Twin Cities where the population is dense? Or are you over on the southwest corner? Or are you at Mayo Clinic, the mothership right down in Rochester? Because it doesn't make any sense. So it's hard with legislators because we are literally trying to sit down with our members of Congress and asking them to send their healthcare staff to sit with us where we're doing deep policy dives and saying, did you know that this stuff doesn't work and we can prove it to you? Here, let us show you what's happening with this, so that they can get out of that frame and understand why Medicare for All is the only way that we are going to be able to fix this. We got Dean Phillips to sign on this year. We got Betty McCollum finally to sign on. And it was through that kind of really hard work. But yeah, it's not that easy. And it takes a lot because people are convinced that we can't do it because of the political moneyed interest. I want to share one more thing before we call on the next person, because we got to win this week, in case you haven't heard. So every year, the Center for Medicare and Medicaid Services issues a rate increase for the Medicare Advantage plans, the privatized part of Medicare, right? They let them know how much they're going to increase their payment to them. So for 2025, they announced that they were going to give them a 3.7% increase. That's $16 billion, which is too much. But the industry, of course, screamed, oh my God, that's not enough. It's a cut. People on Medicare Advantage are going to suffer. I mean, this is really, really bad. You have to increase it. You have to increase it. They launched a huge pressure campaign on the White House, Congress, and CMS. We launched behind the scenes with a group of us nationally, big national organizations. We call ourselves the Reclaim Medicare Coalescence. We launched this massive campaign and engaged the members of our organizations, sent over 70,000 email letters, with 10,000 phone calls, 30,000 signatures on a petition to the White House, 25,000 comments to CMS. And guess what? On April 1, CMS announced that they didn't cave to the pressure. They held tight. We did it. Now, that may seem like kind of a minor win in some ways, but this is a big, powerful industry that tries to take people out of Congress if they don't do what they tell them to do. And just us people on the outside, all of us are volunteer organizations. We pushed back and we got CMS and the White House to do the right thing and stand with us and stand against that industry. So don't tell me the power of the people doesn't work. Because it does.
Thank you.
You bet. Sorry if that took longer than it should have.
Go ahead, Stephen.
Rose, take a deep breath.
Yeah, right? I get a little compassionate about this.
I'm not sure if I need to take a nap after listening, but I have a couple of thoughts. Number one, Rebecca, we have some members that belong to local unions around here. Can you put them in touch with Rose, or at least email some contact information?
Absolutely. Yeah. So UE 150, which I'm sure you probably have contacts with, but yes, we could do that. And then I was telling Rose before folks came on, I'm actually a steward for my union. I'm just getting more involved with our labor council in our area. As anyone on this call knows, this is going to be something I will be talking about in those spaces.
Okay.
Thanks, Stephen.
Number two, some people in the group know that I sent around an article from Barron's knocking Medicare Advantage, and I got some feedback from a group that I used to work with. I was a local chair for a peer learning group of CEOs for about 12 years. And one fellow in particular said he's going to look for a speaker on this. Now, I would urge you to, there were a few words you used that were a little inflammatory
Yep.
to bosses, which some
Right.
of us call management.
I
But
was management.
if you would be interested, I will be glad to give him your name and contact information. If it works and they don't stone you, there are some 600 chairs in 16 countries around the world that run these peer learning groups for CEOs. So it might be a valuable contact, or it may come to nothing.
Well, and I would say that, you know, if the Medicare Advantage article was one of the things that sort of, you know, tickled this guy's fancy a little bit, even better than, I mean, I also do a presentation just on Medicare Advantage and what's going on in that program and why, you know, it's a problem. But even better than me is like Dr. Ed Weisbart from PNHP. Ed is done the deep dive research, and especially at a CEO level, he would be excellent at talking specifically about what's happening inside of the Medicare Advantage programs and plans. So one way or another, if that's an issue that is of interest, maybe that's a good opening to start with talking a little bit about that. And it's kind of funny because I actually spent 25 years in the labor movement in management. I was at the bargaining table with the workers and representing them, but I actually was sitting across the table from the workers in the union as their manager. Hopefully I would be considered a pretty decent boss, but nonetheless, I do wear both hats. So I understand. I figured this was an audience I could take my hat off a little bit on.
Yes, yes. It is, you read the room correctly, or
But
the
I do,
cyberspace
I do,
correctly.
I do this enough that I do know I have to adapt to my audience, and I'm very good at doing that. So,
Okay.
all right, thank you. That's great.
Rebecca, if you could give me Rose's contact information, I will pass it on to a chair in New Jersey.
Okay.
And these are generally groups of 10 to 15 or 18 people
Okay.
that meet
Rose just
monthly.
put her email in the chat for you, Stephen, but if you want me to email it to you directly, I can do that too.
Yep.
Could you do that too?
Yes,
Because we want to keep
absolutely.
you busy now that you're energized.
Right? Yeah. Now that I'm retired and I have nothing to do.
Wonderful. Thank you. Okay, Zach and then Wayne.
Yeah, I work in the value-based care space, so just want to say I agree with all of your criticism, appreciate the Reinhardt reference, all that.
Yes.
And Stephen, also happy to help. You know, my job is speaking to executives and people who think healthcare is a business, so helping to translate between them, happy to help. But the experts you cited, Rose, are probably better. I used to work or consult for Blue Cross of Michigan, so I know they have a very close relationship with the UAW. In fact, the Blue Cross of Michigan board has a significant number of UAW members. Is that on the table? I mean, that Blue Cross of Michigan sells MA plans. They want to grow it. They're putting out all those narratives we just said we have to counter. And yet this Jacobian article Rebecca cites has Blue Cross workers on the picket lines. So I'm curious how you think about a complicated issue like that, given that relationship.
Yeah, and it is complicated. You're exactly right, Zach. And I didn't know about the close relationship between Blue Cross Michigan and the UAW, but that's all part of what we would hope to start to you know, enter into discussion with Sean Fain if we can get a conversation going with him, because It's really frustrating right now inside the House of Labor on this Medicare Advantage thing. I mean, I'm sure most of you know about what's going on up in New York, the city of New York, with the public employees there, and there's a struggle, an internal union struggle going on there with the Medicare Advantage being negotiated. And there's a feeling that the retirees weren't involved really much in those negotiations. And there's court cases. And I mean, it's just, again, it is an example of how this can be used as a dividing issue within labor. But the fact of the matter is that the National AFL-CIO includes Medicare Advantage plans as part of its Union Plus benefits, right? And the same with many unions that if they are lucky enough to be negotiating health benefits for retirees, because in many cases, retirees don't even get that sort of a benefit once they leave active employment, right? But if they do have that, in many cases, they're negotiating them into, Medicare Advantage. And it's all about money, and I understand that. And I don't want anyone to feel shamed because they made a decision based on financial need, whether that's a union, whether that's an employer, quite frankly, or whether that's an individual, right? We do those things based on what we can afford, but we should be aware of what it is actually doing to our Medicare fund overall. And that is why I think the winning strategy that started with a group of retirees out in Puget Sound, Washington, which is to what they call it, level the playing field. PNHP put a report out last year that demonstrates that these Medicare Advantage companies are overbilling Medicare to the tune of $140 billion a year. That is $140 billion that they're taking out that isn't going to healthcare. It's going into their profit margins, dividends, CEO compensation packages. If we took that $140 million back into traditional Medicare, we could wipe out the need to pay a Part B premium. If
Right.
anybody
Yeah, I'm
retired here,
all here
right?
for it, but
Yeah,
happy
no,
to
but what
help.
I'm
But like,
saying is,
oh yeah,
I guess I was just trying to say that this level the playing field strategy doesn't say let's wipe out Medicare Advantage, even though ultimately we'd prefer to see that. It says we have to do something about it. So let's do something together about it. So maybe if the big pitch between Blue Cross Michigan and UAW, or a big piece of it, is the Medicare Advantage plans, maybe we start with the conversation on level the playing field and see if that gets us anywhere, I guess. It's
and I
been
think
working a
it's the
little bit.
commercial business that they care about, but to the extent that Blue Cross MA has a large national MA book of business and a lot of folks in Florida, but happy to get into it. It's been a couple of years, but they hired an ex-Detroit Lion, and his job is to keep UAW happy and with Blue Cross, right? So it's a very important
Sure.
relationship for them.
I gotcha. Well, it's good to know that. I appreciate you just flagging that for me. We would have to think about that and see what UAW thinks about that in
Yeah,
relation to
exciting.
it
Thank you.
being
Yeah,
an obstacle or anything. Yeah.
yeah, happy to flag it.
Yeah. Thank you.
Thank you, Wayne.
Unmute. Thanks a lot, Rose, for the great presentation. And I agree. We appreciate the energy. You are speaking to the choir, of course. We're all folks that have thought of certain angles, but the great thing is you bring other angles and other lifelines of hope, like hearing about the physicians that are organizing up in Minnesota. That article that Stephen sent us from Barron's also really made it sound like that there really is going to be a crisis for the insurers next year, and the fact that CMS is not going along with their request makes that even more likely that we may reach a point where. And I always kind of thought that really after we got past 50% or so of enrollees taking Medicare Advantage, they were going to be getting more and more into more costly patients that they're going to have trouble covering. So we may be seeing that, and it may be sooner than we had thought. If we can just get through this fall elections with an administration that will be somewhat amenable. But thank you a lot for your presentation.
Absolutely. And We anticipate with what I said was the win, right, of keeping that rate at 3.7%. You know, they're likely to do what they always do, right? They're likely this fall, right before the election, to say, well, guess what? Open enrollment's coming up, and we're just going to have to increase the premiums on Medicare Advantage plans significantly unless Congress steps in and gives us a boatload of cash to buy those premiums back down again, right? So we're not out of the woods yet by any means. They do that on a state level. We've done reinsurance here in Minnesota for the same reason, to prop up the ACA exchange, right, that we've got going here. They're very slippery when it comes to this. But at the end of the day, and we work very closely with Wendell Potter. I'm sure everybody knows who Wendell is. And he basically said, if we really do succeed in leveling the playing field, meaning they don't get to keep stealing our money and overbilling and with upcoding and all this crazy stuff they do, they're not going to have a reason to be in that marketplace anymore. They'll just go away. Ultimately, that's what we just assume they do, because they are not spending the money on patient care, and healthcare dollars are too precious to go anywhere but for people's healthcare.
Thanks. Okay, we got Will one more time, and then Margie.
You,
Yeah, sorry. I didn't mean to put myself on stack. No, I'm happy to talk, but no, let's go.
Okay, sorry. Okay, Margie.
I'm going to be at an event with Kamala Harris tomorrow. If you had 30 seconds with her, what would you say, or what advice could you give me to make a pitch? Because we know that she supported Medicare for all, but then had to kind of toe the line on the ACA stuff when she ran with Biden. So what might be a good pitch to her for the short term?
I think the short-term pitch is, Vice President Harris, a winning issue is protecting Medicare. We are talking directly with the White House, actually, with that coalescence that I was mentioning earlier, met with Neera Tandem from the White House about how this is a winning issue for the president and for the vice president to run on, which is to protect Medicare, deal with the overbilling and the fraud and abuse that is happening inside of it. And let's make traditional Medicare something that is economically available for everyone. Let's, keep working on those price negotiations for pharmaceuticals, and keep thinking about how we can drop the age of eligibility and how we can expand the benefits to cover things like dental, hearing, and vision. That was on the table during the Biden administration in the Build Back Better bill. They supported it, and we couldn't get it all done. Got the price negotiations, which was a good first step. But if he gets a second, administration here, it's time for them to take it back on again, because we could now potentially get it in a second administration. So I really think it's about selling it, because you ain't going to sell her right now on Medicare for all, because he doesn't support it. But we could, I think, pushing the protection of Medicare and pumping up traditional Medicare and dealing with the abuse and fraud that's happening is a winning strategy.
Yeah, the parts of that Build Back Better, the health
Yeah.
parts, when they did national polling, they were by far and all the things related to Medicare were by far the most popular things that were driving that bill. I just want to throw out also to put a cap on out-of-pocket costs for traditional Medicare.
Yes.
I think
Thank
it's
you.
one of the biggest things that we can
Thank you.
do to
Yes.
actually level the playing field. It's the
That's right.
biggest problem now. It's why, if you can't get a Medigap plan, why traditional Medicare is so not affordable for people.
That's right.
Because there's not that cap on that 20% out of pocket. So
That's right.
you could very easily go broke.
And I will let you guys in on something. Our coalescence has actually been asked by Senator Warren and Representative Jayapal and a few others in Congress to work with them to prepare some legislation that I don't know if it's going to make it this year, but for sure to have it ready to drop in 2025 to do these kinds of things that we were just talking about. And thank you, Rebecca, for that, because that is a critically important part. And again, recapturing some of the money that they're stealing from us, we could use it to cap those out of pocket. And that's what begins to level the playing field, because we know that the out of pocket is a little bit less in some Medicare Advantage plans, but they usually get you on the back end. So it ends up being cheaper on the front end, but then all of a sudden you get hit with surprise bills and now you're sick and they don't want to take care of you anymore.
Right. And and they also have the silver sneakers and the
Yeah,
gym,
oh God, right, exactly.
and the minuscule vision benefit, and like,
Yes, exactly.
like all of these things that look so good on the outset.
That's right.
Yeah. Rose, I would love a chance to talk with you more about a lot of different things.
Yeah, sure. So we
So
could
I would
connect
love a
sometime. Yeah,
chance, because I have a million different things in my head, but
sure.
I know
Email
it's
me.
already 8:05 and we can set up
Yes.
a time to talk.
Yeah.
Which would
Love
be
to.
great. Are there any other questions before I just get to like one housekeeping issue before we sign off? Any other questions? Rose, thank you so much for
I want to
this.
thank you all. Great questions. Thank you so
you.
much for having me. I hope it was somewhat helpful, and I will get those slides out. And Rebecca, you've got my email. You email me and we'll set up a Zoom to just kind of catch up, and I'll make sure that Doug gets these slides so he can get them out to all of you.
Wonderful. Yes, that
Thank
sounds
you all.
perfect. Thank you so
Have a
much,
great
Rose.
evening,
We
everyone.
appreciate
Thank
you.
you.
We appreciate your passion.
Right back at you. Thank you. Bye-bye.
That was like listening to me speak. It was so wonderful. It was like incredible. So I hope everyone got something out of that. I thought it was fantastic. I'm very curious to hear about what I wanted to ask more about her working groups and stuff, but I know it's already 8:07. So I did want to just say that we are going to need help, and I wish Mariah was still on too, but I'm glad Katrina's still on. We are going to need help moving our website. So Healthcare for All North Carolina has been very generous in paying for our Nation Builder, which is where our website and sort of all of our lists are hosted. They are moving to a different system. So they're going to have one system that's going to host the website, and then they're going to a free system that is hosting sort of the email list. They have generously said that they will still pay for the website hosting for us. We're gonna need, and I'm gonna put out a call for this as well. And Katrina, we could definitely put this in the larger email, a call to help. Websites is definitely not my thing, that kind of technology. So, if anyone does understand that and can sort of help, as we're going to be migrating, the coordinator for Healthcare for All North Carolina has just done a great job of finding out information and would be happy to help us share the information that they've learned about sort of how to do this. But we're definitely going to sort of need help for that, so that we can keep our website. Maybe we can tweak some things and take some things off, but I still think having the website up there that promotes the work that we're doing is very important. And I definitely want, I talked about the last meeting too. I just think there's a lot we can be doing comms wise, communications wise, to really engage with people. I've been talking with Royce about doing and this came up at the Healthcare Justice Legislative Communications meeting, doing like parody videos that can be like very funny about how messed up our system is. I mean, if we can come up with super clever things, then maybe they can go viral and we can be, teaching people about our system and helping build this. So anyone that is interested in either of those things, please reach out to me. Also, I'm still working on the candidate questionnaire. And I've sent out the link to that too. I have like 1 or 2 other questions that I'm going to work on, and then hopefully it will be ready for sort of final look over for people. So we'll be sending that out as well. From there, we're going to need help getting the word out about, by the way, I just found out something very interesting, and I know she doesn't have a chance, but in District 14, which was Jeff Jackson's district, but they redistricted it, and now Tim Moore is running. So Tim Moore is the Speaker of our House, the North Carolina House, but he's running for Congress. The woman he's running against is a registered nurse, and she's married to a family doc. And she has, I mean, she has public option written on there, but I think she's just a very interesting person to be talking to about this. We're going to be reaching out to her because we're going to be doing medical debt, Medicaid expansion enrollment right in Burke County, which is where she lives, because we want to make medical debt a campaign issue for Tim Moore, because we want him to bring the Medical Debt De-Weaponization Act up for a vote. So we're going right smack into his territory, hopefully next month to do that. And of course, we're going to invite her as well. So hopefully I'll have contact. So at the very least, we can get the questioner to those 2. And obviously, I know Alma Adams and Valerie Fouchi, but we're going to need help to get it into the hands of all the people that are running. So that's another way we can all be involved. And then once we get those responses back, we're going to be working with a graphic design firm to actually create a candidate, a voter guide. And again, this isn't just a single payer candidate questionnaire this time. This is going to be more overall health policy, because there are things that, you know, that we can be really pushing for folks to support, like Rose was talking about, and I know you've heard me say it before as well, that can at least help people right now that we can move forward on. And if people say they support something in writing, then we can hold them accountable if they're not going to support it. All right, was there anything else? Oh, does anyone have any announcements that they want to make before we jump off? All right. Well, thank you, everyone. Really appreciate your time, and I hope everyone has a great rest of your week.
Thanks, Rebecca. Great
Thank
meeting.
you.
Thank you.
Bye.
Great night.
Thanks.